living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Retirement is a big change, but it is one that is well earned after years of working, planning, and navigating the good and the bad. Today we are going to celebrate retirement by speaking with Mountain Pacific CEO Sara Medley, who is going to be retiring very soon. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown, and today we're going to get some insights on health, healthcare, and planning for retirement. Stay with us. Welcome back to Healthy Living for Life. Joining us today is CEO Sara Medley from Mountain Pacific Quality Health, who is going to share some insights and tips after decades of being in the healthcare industry. So thank you for being here, Sara, and being in the interviewee seat instead of the interviewer seat today.
Well, thanks for having me, Beth, and I will say it feels awkward sitting here and not where you are.
Well, I know you have a lot of great information and experience, and you're well respected, so I'm excited to hear what sort of wisdom you have to share with us today. So let's get started and talk about healthcare. And you got started, I won't say how many years ago, though you always joke you started when you were 14, so maybe you can say how many years ago, but how did you get started in healthcare?
Well, a bit of serendipity, I would say. So my mother was in healthcare. She was one of those that loved to work. She was a professional, and she started in the healthcare field doing health records back then. It was called medical records. And she was my inspiration. I knew I didn't want to deal with blood. I was a little squeamish, so I knew nursing would not be in my career path, but our local college had a course on health information management, and I thought that sounds intriguing, and I went that route, got my degree in it, and you know, the rest is history.
Yeah, it's funny that healthcare seems to kind of run in the family, doesn't it?
Yep.
So then when did you get started at Mountain Pacific?
Yeah. So my first job, to go back, was at a local healthcare facility, a hospital, and I started their first QI program. Wow. And so when I started that was way back in the days when you called it QA, quality assurance, and you were literally checking boxes, making sure that physician orders were done and lab work was done, and it was very rudimentary, and of course it was all paper. But I got recruited by a physician who started our organization, and back then it was called Montana Foundation for Medical Care. He saw something in me that said maybe she could do something across the state rather than just in one hospital. So back in Gulp, May 1977, long time ago, I started with Mountain Pacific.
Well, thank goodness that he saw something in you, because you have done such great work over the last 45 years.
45 years.
So
hard to believe.
That's a long time to stay at a company. Mm-hmm. Talk about that a little bit.
Mm-hmm. Yeah, so many people have said, well, my gosh, how could you possibly stay at a company for 45 years? The reason is it was a contract-based nonprofit organization, and every time we would negotiate a contract with a new entity, usually the federal government, usually Centers for Medicare and Medicaid Services, an arm of the federal government, the work changed. So we would do everything from doing consultative work in every small hospital in the state of Montana back then. And we actually flew to these tiny little places, and I would go on site and provide services to the hospital and the nursing home. And then it would change from that to now we're looking at medical records, and we're deciding if hospitals and doctors and coding people are doing their job correctly using coding. So every diagnosis had a code, every surgical procedure a code. So imagine you go from on-site consultative, now you're looking at records, and then the next thing you're doing is population health work. And the metrics change, the people change, but the mission stays the same, which is making people's lives better.
So that is such a great service, going into those facilities and helping those doctors. But I have to ask, what did they think about you coming in and trying to help them?
Yeah, that's a great question. They didn't like it, right? So back in the day, I mean, it's a little odd to say, but we were the PSRO, or the Professional Standards Review Organization, and the physicians back then called us pissaroos. They did not like it. And you can't blame them. You know, they were used to doing things themselves with their own rules, their own regs, and now the government is saying you must do this. So it was challenging, and I think that's where I learned the power of gentle persuasion, and that if you really went at it from the view of the patient and convinced people this is right for the patient, and we're all patients at some point in our life, then the sell is easier. And I never looked at myself as a salesperson, but that's really what I was doing.
Yeah. And of course, the providers want to look out for the patient too. So come along with us together. And really, it hasn't changed that much as far as the core of Mountain Pacific, but I'm sure there have been a lot of changes over the last 45 years. Let's talk about those a little bit.
Yeah. So started off with one state, and then I was fortunate enough to be part of a great team, and I had a good CEO mentor, and we were able to get additional states. So we got Wyoming, federal contract in 1986, and then Hawaii came in 96, so we started doing federal work in Hawaii, and Hawaii actually included Guam, American Samoa, and Saipan, referred to as the Commonwealth of the Marianas, and that was wonderful work. We had an office in Guam and board member from Guam, and then in 2005 we got Alaska. So amazing work doing a huge geographical region, but the population very similar, very rural. If you throw Honolulu and Anchorage out, all of our states are very rural.
So let's talk about what all of that has led to. When you look ahead, what do you think's in store for healthcare?
Yeah, it's challenging times right now for healthcare, and it's always been challenging. But we're seeing nursing homes close nationally, and I know in our local state of Montana, we've had, 8 or 9, maybe even 10 now, nursing homes close. And a lot of it is staff related. You know, we're all seeing where companies are short-staffed. We don't have enough workers, and nursing home work is extremely difficult work. And if an individual can make more money at McDonald's than taking care of me in a nursing home, you know, it's kind of an easy choice. It's hard taking care of patients. So that's a challenge. And then there's a lot of competition. You're seeing hospitals gobble up other hospitals. You're seeing more competition in local communities. And then you're seeing shortage of physicians, shortage of nurses. So it's challenging.
For sure. All right, we ran out of time, so we need to take a break here really quick. But when we come back, we're going to talk a little bit more about health and healthcare and what that might look like, and some other ideas and planning for retirement. Stay with us. We'll be right back after these messages. Welcome back. We're talking with CEO Sara Medley this morning about health and healthcare and planning for retirement. We're going to talk a little bit more about health and healthcare because you talked about all those changes and challenges before the break. So let's talk about what that means for a patient. How does a patient get the most out of his or her healthcare with all of these challenges and changes going on?
Well, it's a struggle for sure. I have the view that patients, and you know, I'm one as well, we all are, we need to take more of an active role in being an advocate for ourselves. And those are words, and what does that really mean? Well, when you go to your physician, make a list of questions first so that you don't forget anything. And if something happens in that visit that makes you uncomfortable or bothers you, speak up respectfully, you know, with kindness and professionally. Don't berate healthcare team members. I mean, they don't need that. But be a force to reckon with in a good way. And really ask those hard questions. Why do I need that? How much is it going to cost? What can I do better to take better care of myself? I think those are all important.
Yeah, they're good questions, and we should advocate for ourselves, and not only about our physical health, but something we've really, talked about a lot on this show is trying to get some of the stigma around behavioral health and mental health to go away. So what's your advice there, Sarah? What are we seeing as far as changes in mental health, and how can a patient advocate for themselves there?
Yeah. So there's good news, in my opinion, about the mental health situation, and that is many, many years ago. So talk about 20 years ago, 25 years ago. If you had a mental illness, that was like a big red stamp on your forehead. And you didn't talk about it. You didn't talk about feeling depressed or anxious or sad. We were all supposed to cover it up, put a smile on our face and march on. And I think what we've learned over the last even 10 years is that mental health is an illness and it needs to be treated with respect. And I think we're seeing our physicians ask questions when we're visited. So I had an annual exam recently, and one of the questions asked me was, do I ever think about suicide? And I've never been asked that before. And thankfully, I am a positive person and I have not had to deal with depression, but I have friends and relatives who have. And so I was thrilled they asked, and they were almost apologetic about asking. But I think that's really important. And the other thing I think is important is something that I'm an advocate for, which is adverse childhood event screening. And we've had conversations about that on our show, ACE it's referred to. And it's a very simple questionnaire where you ask 10 questions, and if you score 2 or 3 or 4 out of 10 in the positive, you're at risk for some serious health problems. So I think doing more of that will help all of us.
Yeah, it's amazing how those kind of things can stick with us and we don't even know the impact that they have from our childhood. So let's switch gears a little bit here and start talking about retirement, which I think you're retiring too soon, but I know you're ready. How did you know you were ready? Because I know you thought about retirement a couple of times before actually pulling the trigger on it. So how did you know? What were some of the things you considered?
Yeah, that is a question I have pondered now for months. So I originally thought about retiring seriously in 2020. And as I thought about it, guess what happened? COVID pandemic, right?
Right.
And I saw our organization and our IT department having to literally take 100 people, almost, and get them from working in a home environment, an office environment, and moving them to their homes, where about 90% of our folks had to work from their homes, doing the great work we're doing, but not in an office environment, which was a huge change.
Yeah.
And at that point, I thought, I need to help us all navigate through COVID. So fast forward 12 months, thought about it again, and my husband became ill. We'll talk about that later, I believe. And I decided I needed to work for my own well-being. I needed outside stimulus. I needed my work family around me, even though they didn't necessarily know what I was going through. But I needed to be busy and productive and fulfill my why of making people's lives better. So then when 2022 happened, I decided this is the year. I need to take better care of myself, and there's more to life than working, is the short answer.
And that's so true. And we're coming up on a break again, but I do want to talk about you as a caregiver, because there are a lot of those out there that could benefit from what you learned through that experience. So we're going to pause here for a quick break, but when we come back, we'll talk about some tips about caregiving and what to consider if you are a caregiver or someone is caring for you. And then we'll talk about how to take care of your family when you are considering retirement. Stay with us. We'll be right back. welcome back. Thanks for staying with us. We're still talking with Sara Medley, who is the CEO of Mountain Pacific Quality Health, but not for very much longer. So we're benefiting from her good insights while we can. So thank you again for being on today. So you mentioned your husband. Let's talk about Adrian. He had Alzheimer's, which I can't even imagine how challenging that was for you. Can you talk about some of those challenges?
Yeah. So when someone you love has Alzheimer's, obviously you have to relearn, I guess, how to deal with that individual. He was a brilliant man. He was a very gifted surgeon and a bit of a renaissance. He wrote poetry, an extensive reader, and could do anything. And as that changed, he became frustrated. And I became frustrated, so you have to learn how to deal with someone that you really don't know. It's like living with a stranger. And I think that was probably the most difficult, and then being patient and kind. That was a struggle because he often would lose his temper, and as is common with Alzheimer's and some forms of dementia, the immediate caregiver is the one, and usually it's the wife or the husband who gets the brunt of that anger, and that was really hard.
Yeah. And so you got help. So what were some lessons learned from that experience and bringing people into your home to help you out with all of that?
Yeah, lifesaver. So I was fortunate. My husband was a veteran. He served in a hospital Vietnam War era, and so he took care of veterans, and thankfully the VA has a wonderful program that allows home care in your home. So when it got to the point where he was not able to be very mobile, folks would come into our home, PT and some OT and occupational therapy, physical therapy, and then nursing care, and then my angel caregivers. And they were my respite to allow me to not only work, but to also get out of the house. And so my message to my viewers who are dealing with this is find a friend, your church, senior center, find a way to get out of the house every week, even if it's for an hour, even if it's to go to the grocery store or to have coffee or a beverage with a friend or take a walk. Get out of the house because you need that respite.
Yeah. You can't take care of someone when you're not taking care of yourself first. And eventually Adrian had to go into a facility there right at the very end. What's your lessons learned, or what would you tell our viewers about that and what you considered there?
Yeah, well, it wasn't much of a consideration because at the very end he became so agitated that I had to fear for my safety and my caregiver's safety. So once he went to the hospital, then he took a turn for the worse and needed to go into a nursing home. I couldn't physically care for him, and my caregiver couldn't care for him either. It would have been not a good situation at the house. So in choosing the nursing home, it really was chosen for me because there weren't a lot of beds available. So the nursing home he was in took good care of him, but the best piece of it was hospice. And so a big plug for our hospice caregivers. I don't know what I would have done without them either. And then of course my caregiver was there also with me. So when I couldn't be in the nursing home with Adrian, she was. And reading to him, and it was a blessing to have those caregivers.
Well, thank you for sharing that. I know that was such a tough time in your life, and only those who go through it can truly understand. So, of course, Adrian was one of your considerations when it came to retirement, and so then what? So what were some of the other considerations that you had or thought about it to know it's time, I'm going to retire?
Yeah. So two important things. One, my kids and my grandkids. And the thought that I'm healthy and I'm active and I need to take advantage of that, and I want to spend more time with them. So that was a consideration. I enjoy travel, want to do some traveling, and I want to give my team members, who are young professionals with a lot of energy, I wanted to hand over a strong organization and let all of you run with it, because you can take it to the next level and beyond. So it was time to pass that torch, and I knew it.
Have you gotten any outside help for planning for your retirement?
No, not really. You know, the financial piece of retirement is something that I have felt I'm pretty well prepared for, and it's using our own vendor who sponsors our 401k, reading materials. So I would encourage anyone thinking about retirement, even if they're thinking about it in 10 years, save and save some more, participate in your retirement program at the office, or go online and read, research.
That's great advice, and I'm sure you've also gotten some advice about your retirement. Mm-hmm. What are some sage words that you would pass on that maybe you got about your retirement?
So one is don't overcommit. So I did on a lark form an LLC, and my kids didn't even know it. So Clear Blue LLC, because I thought of it out of the clear blue, as my lifeline. If I decide that I'm bored and I want to go on the streets and sell pencils, I'll have something to hang on to. But in the meantime, not to overcommit. I've always been a big volunteer in my community, and I know there are a number of organizations with which I could volunteer, but I'm going to take a break, do some traveling, and do things that I want to do, like relearning how to play the piano and learn how to swim for real and for exercise.
That's great. Well, we're almost out of time again, Sara. So closing thoughts, looking back on your career, what are you going to take with you as you enter into the great wide retirement?
Yeah. Well, two things I'll reflect on. One, be a kind leader, be a kind professional. And that used to not be talked about as an attribute of a leader, but it really is a strong one. Be kind. And the second, always hire people a heck of a lot smarter than you are, and then get out of their way and let them do their thing.
Well, that's very nice. I don't know how you found people smarter than you are. And I know you've heard this a million times. You're going to be so missed, Sara. If I wasn't tethered to a microphone, I would give you a hug, but I know we'll have time for that later. So
yeah. Thank you, Beth,
for being on today.
Thank you.
And thank you so much for tuning in. We hope you'll come back and see us again next weekend. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week and happy holidays, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.